We're going to start looking at the veins of the systemic circuit now. So the first one that we want to note is the first one on our list, which is the superior vena cava. So looking on the right picture here, so the superior vena cava is here. So we've talked about it in relation to the heart. I'm just going to abbreviate it. So it drains blood into the heart coming from the upper limbs and the head and the neck region. So draining into the superior vena cava are the right and left brachiocephalic veins. On this model here, we can see the left brachiocephalic vein here really well, but they don't really show one here. They have a very short little piece. We can see it a little bit better on this one. So here, to orient ourselves again, is superior vena cava. Here's the left brachiocephalic vein, and then here's the right brachiocephalic vein. So again, they both drain into the superior vena cava. Next, we want to talk about the internal and external jugular. So these are going to drain blood from the head and neck region. The internal jugular ultimately drains blood from the brain, internal structures of the face and neck. The external jugular is going to drain external structures. Now this is, when we look at the internal and external jugular, their pattern is not the same as the internal and external carotid. So remember, those were branches, I should say, internal and external carotid artery. Those were branches off the common carotid. But in the veins, what we have is the internal jugular here. So this is the internal jugular vein. And then more laterally, we have the external jugular vein. And this is very superficial. So this sits on the surface of the sternocleidomastoid, so that big rope-like muscle in the neck. So you can usually see this pretty easily deep to the surface of the skin, especially if you kind of pull the skin tautly over that vein. So sometimes you hear about people going for the jugular, so that would be the external jugular, because it is so superficial. So the jugulars drain blood into our next vein here, which is the subclavian vein. So just like we have a subclavian artery, we have a subclavian vein. On this picture over here, our subclavian vein is right here. Subclavian vein. And so it's the blue vessel here. It runs right alongside the subclavian artery. Now, as we move to the axillary region, so there are going to be a few different vessels that drain into the subclavian vein. So this one is going to be the cephalic vein. It's kind of weird because we usually think of cephalic, or we know cephalic means head. And I looked it up one time, and the name came from a misinterpretation of another term that meant outer. I think it was a Persian term, and someone interpreted it as head. And so the name just kind of stuck, even though, again, cephalic usually means head. This cephalic vein runs through the upper limb. So, and then we have the brachial vein, was going to run alongside the humerus. In this model, it is cut, so we can't see the vein, but it would be running deep, again, along the humerus here. And then we also have the basilic vein, which is a more superficial medial vein, so this basilic vein. So I think of it alphabetically, so basilic, brachial, so basilic, brachial, and then cephalic. Is one way to kind of help yourself remember that. So as we move along the limb, so more distally, so the basilic vein again runs medially here. We have this vein here called the median cubital vein, which is typically the vein from which blood is drawn. But this median cubital vein is here, so it connects the basilic vein here to the cephalic vein here. Okay, so that's the median cubital. On this model, we can't see the radial and the ulnar vein. So what I want to do is to look at a diagram. So here's a diagram of the upper limb. So just to orientate ourselves, so here's the basilic vein, here's the brachial. So this picture also shows the brachial vein, which was cut off on the image of the slide. And then here's the cephalic vein. Here's the median cubital that connects the basilic to the cephalic. So we can see the brachial vein continues down past the elbow, and then it branches into the radial and the ulnar vein. So here's the radial vein here. So it runs alongside the radius, and then here's the ulnar vein here. So running alongside the ulna in the forearm there. So this is just another image just to look at those specific veins that are not shown on the model. All right, now we want to move on to veins in the abdominal cavity. So one thing to note here is that the largest vein running through the abdominal cavity is the inferior vena cava. And this one also runs into the thoracic cavity, and remember it drains into the right atrium of the heart. So this model is not showing that. We just see the superior vena cava, but just recall that the inferior vena cava drains into the right atrium, and it also runs through the abdominal cavity here. So it runs right next to the abdominal aorta, right? So we have these two large vessels, kind of like I-35. Blood is moving down the artery and then up the vein, so moving in opposite directions there. So that, I'm going to erase this scratch here. So that's, again, the inferior vena cava. So all the way down here, inferior vena cava. The hepatic vein here drains into the inferior vena cava. So the hepatic vein is the vein that drains the liver. Hepatic vein. And you want to keep this separate from the hepatic portal vein. So we can't see the hepatic portal vein on this image. We're going to look at it in another model. But recall that the hepatic portal vein drains blood into the liver that is coming from the intestines and the spleen and the stomach. So it's not freshly oxygenated blood. It's not completely deoxygenated blood. It's kind of like nutrient-rich blood is how we usually refer to it. But the hepatic vein drains directly into the inferior vena cava. So this is draining blood that has been processed after it has gone through the liver. So the hepatic portal vein we can't see on this model, neither can we see the suprarenal veins, but we can see the renal veins. So here are the renal veins. So these are just the veins that drain the kidneys. We can't see the gonadal or the lumbar veins on this model, so we'll come back to those. But what we can see here is, so as the inferior vena cava gets towards the iliac crest again of the coxal bones, we see it receiving blood from the common iliac vein. So we have right and left common iliac vein. The common iliac vein receives blood from the internal iliac vein and the external iliac vein. Okay, so when we think about venous blood, remember that it's all moving towards the heart. So in the venous blood vessels, in the veins, the veins are always merging together, right? So the external iliac and the internal iliac are merging together to drain the blood into the common iliac. And then the right and left common drain the blood into the vena cava. So it's hard not to think about it branching, like we talk about the arteries branching, and that's because the arterial part of the vascular tree is diverging, whereas the venous is converging. And so I've been saying drain into, like talking about the external iliac vein, drains into the common iliac because the blood is moving up this way. And through the internal iliac, it's moving this way. So it's a little bit cumbersome. It's like you want to talk about the blood vessels branching, but in truth, the venous veins, again, don't branch. They're merging together. But those are the external iliac and the internal iliac. Now let's look at these images here so we can see some of the veins that we couldn't see on the other image. So first to note here, we have the hepatic portal vein here. So this is our small intestine. This is the spleen. So in the body, this model here, these organs would be flipped, right? Because the spleen is on the left side, the small intestine is more on the right. And again, our liver would be here. And so this hepatic portal vein here, a lot of times it's represented as a purple vessel. And that's again because it's carrying neither oxygen-rich or completely deoxygenated blood. So this is the hepatic portal vein. This would be the superior mesenteric vein, just to sort of orientate ourselves. So remember, the superior mesenteric vein drains into the hepatic portal. So does the splenic vein, which we have here. And then the inferior mesenteric drains into the splenic vein. Okay, coming to our torso model on the left here. So one thing we can just barely see here is the suprarenal vein. So that's going to be draining blood from the adrenal gland. So suprarenal vein. Here are the gonadal veins. And there's not symmetrical on the right and left side. Right, so our the right gonadal vein drains directly into the inferior vena cava. So that's what we're looking at here. The left gonadal vein drains into the renal vein. So the renal vein here that's draining the kidneys also receives blood from the gonadal vein here. Someone asked me why that is one time, and I don't know why we have that difference in the draining of the right and left gonadal veins, but that's what it is. Now we want to look at veins of the lower limb, and I have 3 different images here, just because they all show some things and not others. So on this left-hand model here, left model on the left side, so here's our external iliac vein. And draining into it is the femoral vein. And it's not shown very well here. But we can see it. So on this image here of our leg model, so again, this is external iliac. And it receives blood from the femoral vein. So it changes from femoral vein into external iliac vein as it moves through or past that inguinal ligament again, just like we saw with the external iliac artery turning into the femoral artery. So the femoral vein runs alongside the femur, so the big bone of the upper limb, but it doesn't show the femoral vein continuing on this model here. And again, you can barely see the femoral vein. So where it's a little bit easier to see is here. So this is showing us the femoral vein. And then also on this picture here. So the femoral vein is here. And then it continues again deep, running alongside the femur. So it's kind of this darker blue here. Draining into the femoral vein is the longest, most superficial vein in the lower limb, called the great saphenous vein. So in this model here, and I changed my color just so we can make sure we see it. So in this model on the left, the only vein we see running along down through the thigh area is the great saphenous. So the great saphenous vein, we also see it here. So again, it is very superficial. It is on both sides, but we only see it on one side here. So this is the great saphenous vein. So very commonly, this vein will be used for bypass surgery when coronary vessels need to be bypassed, like if they're clogged. So that's the great saphenous vein. The other vein that we want to look at that we can't see on any of these models is the popliteal vein. And that runs through the popliteal region, which we know is behind in the area behind the knee or posterior region of the knee. So we're just looking at this model here. So the popliteal vein is here. So it runs alongside the popliteal artery. So this is the popliteal vein. Here we are looking at a mid-sagittal section of the head, so probably something you would have looked at during A&P 1, but we want to note the structures that are involved in the drainage of blood from the brain. And we just want to identify two sinuses. There are more, but we want to identify two. So one is the superior sagittal sinus, which is here. So the superior sagittal sinus runs just below the longitudinal fissure. Just above the longitudinal fissure. And then the superior sagittal sinus drains into a transverse sinus, which is here. And then ultimately the sinus will drain into the internal jugular. So the internal jugular takes the deoxygenated blood away from the brain, again receiving it from the sinuses.